You are able to see the dissection? Hello?
Yes, ma'am.
You are able to see?
Yes,
Yeah,
ma'am.
ma'am.
Okay, so this is the pectoralis major. After this insertion, we are cutting all this muscle. So I'm just showing. Our intention is to show about the brachial plexus. Pectoralis region I will show in the next video. Okay. So this is the pectoralis major muscle. Pectoralis major muscle, which is the anterior wall of the axilla. So what are the anterior wall of the axilla? Pectoralis major and minor, right? So see here. So this is the pectoralis major muscle. So it's cutting and removing. It's reflecting now. So pectoralis major is over. Now this is the pectoralis minor. So this also forms the anterior wall of the axilla. Okay, right? And now we have to see the latissimus dorsi. See, did you see the latissimus dorsi here, students? Yeah, that is the subscapularis. Okay, subscapularis and teres major. So that is the posterior wall of the axilla, right? And here you can see the serratus anterior. I mean this serratus anterior side and the chest muscle. So these are the medial wall. So hope you understood. Anterior wall already reflected. That is the pectoralis major and minor. And the lateral wall, the latissimus dorsi, teres major, subscapularis, that forms the posterior wall of the axilla. And the lateral wall, that is the subscapularis, you can see the lateral wall of the axilla, and intercostal and the serratus anterior, that is the medial wall. Is it clear? Till this, it is clear?
Yes, ma'am.
Okay, fine. So now we are searching for the brachial plexus. So for that we have to see the M landmark. So see, this is the M landmark. See, here you can see two limbs. One limb is here, another limb is here. So this is the M landmark. Two limbs of the M. Is it clear, students? You are able to see the two limbs?
Yes, ma'am.
So here you can see this is your musculocutaneous. So this is the lateral cord. So musculocutaneous we studied. It takes origin from the musculocutaneous. And here you can see the median nerve. So median nerve, which is formed by the fusion between the lateral root and the median root. And this is the ulnar nerve. Did you see the ulnar nerve? See, this is the medial cord and this is the lateral cord. So in between you can see, I'll show you, wait. Yeah. So in between you can see the axillary artery. So according to the axillary artery, which is lateral to axillary artery, that is the lateral cord. See, this is the lateral cord. The central one is axillary artery. Okay. And near to that is the medial cord. Okay. Then in this dissection, we can't see the roots and trunks because these are in the neck portion, right? And the divisions also we can't see because that is in the cervico-axillary canal. So we can see only the cords and its terminal branches. So let me show one thing. Yeah, lateral pectoral nerve. Did you see the lateral pectoral nerve? This one. This is the lateral pectoral nerve. And here there is a communicating branch which is connecting to your medial pectoral nerve. So how you will identify this lateral pectoral nerve? See, this is supplied to the pectoralis major. Okay, and now you will realize the pectoralis minor. How you will identify the medial pectoral nerve? I'll show you once again. This is the musculocutaneous nerve. Okay. This is the musculocutaneous nerve. This is the lateral cord. This is the medial cord. Is it clear, students? This is medial cord. Okay. See, this is the ulnar nerve. This is the ulnar nerve. This is the ulnar nerve. So medial cord, which is medial to the axillary artery, lateral cord, which is lateral to the axillary artery. And here you can see this is your, which one he is tracing now. This is the ulnar nerve. Ulnar nerve, it will come near to the, one second. This is the medial pectoral nerve. See, this is medial pectoral nerve actually, which pierces the pectoralis minor, and it will, yeah, see here, medial pectoral nerve which is supplying to the, this is pectoralis minor, which one he is showing. After that it piercing, see, after piercing, and it will supply to the pectoralis major muscle. So see, this is the pectoralis minor. So back of that, this medial pectoral nerve is there, which is going to supply the pectoralis minor, and this pectoralis minor, the medial pectoral nerve which pierces and supplies to the pectoralis major muscle. See here, medial cutaneous nerve of the arm. It will continue as the forearm. Okay. See, this is the medial cutaneous nerve of the arm, forearm. So see, this is the posterior cord. This is the posterior cord. Which one? In the biceps. Yeah, posterior cord. Okay. So the terminal branches of the posterior cord. So see, this is the radial nerve and this is the axillary nerve. So these are the two terminal branches of the posterior cord. This one. Okay. So in between the posterior cord, two terminal branches. Divisions of the brachial plexus, you can't see. Yeah, this is the upper subscapular nerve. Upper subscapular nerve. The thoracodorsal nerve. These are the branches of the posterior cords. Thoracodorsal nerve. Latissimus. This is the latissimus dorsi. So these two nerves we have to safeguard during the time of dissection, or during the time of axillary dissection or some breast surgery. That dorsal scapula we have to preserve. So see, this is the long thoracic nerve of Bell. This supplies to the serratus anterior. This is the one. So axillary dissection or after mastectomy for breast cancer and all, we have to safeguard this long thoracic nerve. It is very close to that. Okay. So if something happened to this root value of the long thoracic nerve is C5 and C6, and something happened to this long thoracic nerve of Bell, so it will lead to the winging of scapula, and we have to preserve that thoracodorsal also, because that will lead to the sensational loss. Okay, or not the sensational loss, paralysis of the latissimus dorsi. So these all are, which one he is showing now, the collateral branches. So we have to safeguard long thoracic and the thoracodorsal while this dissection and the breast surgeries. Okay. So these are the terminal branches. Hope you understood. Musculocutaneous, axillary, radial, ulnar and all. Yeah, thoracodorsal nerve. Sorry, dorsal scapular nerve. So that supplies to the levator scapulae and the rhomboides. Root value is the C5, suprascapular and nerve to the subclavius. Okay, so hope you understood. Hope you understood the brachial plexus, from where it took origin, what is the course, and how it will be in the dissected body, and all. So, is it clear, students? Hello.
Yes, ma'am.
You are able to see my screen, pectoral region?
Yes, ma'am.
Okay,
Yes,
so
ma'am.
hope you understood that brachial plexus. You have any doubt from that topic? Any doubt? Students, please respond, then I can move to the next topic. Any doubt from the brachial plexus?
No, ma'am.
You are clear with the topic? It is useful to you, or how it is? How you are feeling?
It's clear, ma'am.
It's clear. Okay, then we'll move to the pectoral region. So what do you know about the pectoral region, students? Pectoral region, you can see the pectoral region, the cutaneous innervation, the skin of the pectoral region, which is supplied by the branches of supraclavicular nerve and the ventral rami of the intercostal nerve. Okay, so next will your topic is the muscles of the pectoral region. So you can learn the muscles. One more muscle is the serratus anterior. That is not fully the pectoral region. We can consider it as the pectoral region muscle also. So in this group, we can learn the serratus anterior also. Okay, so pectoralis major, pectoralis minor, and subclavius serratus anterior. These are the muscles which is seeing in the pectoral region. Okay, and the first is the pectoralis major. So which one you are seeing in the picture? That is the pectoralis major. So as you know, the pectoralis major have two heads of origin. One is the clavicular head, which is from the medial third of the anterior surface of the clavicle, first origin. See, this is the clavicular head. And another one is the sternocostal head, sternocostal origin, that is from the anterior aspects of the sternum and the upper six costal cartilage. Okay, so hope it is clear. This is the pectoralis major muscle. If you are dissecting the body, once you remove the skin, superficial fascia, deep, I will show the video after the class. Superficial fascia, deep fascia, you will see the pectoralis major muscle, which is the main muscle of the pectoral region. So the pectoralis major muscle, which is having two origin. One is the clavicular origin and another one is the sternocostal origin. So the clavicular origin, that is the anterior surface of the medial third of the clavicle, and sternocostal origin, that is from the anterior aspects of the sternum and upper six costal cartilages. And see the insertion where it is inserted, lateral lip of the bicipital groove of the humerus by two lamina, anterior lamina and the posterior lamina. I'll show the same in dissection also. See, this is the two lamina. This one is the anterior lamina and this is the posterior lamina. As you know, the anterior lamina, which consists of three type of fibers: superficial fiber, intermediate fiber, and the deep fiber. I'll show in the dissection video also. So hope you understood pectoralis major muscle and what is the action: medial rotation and adduction and flexion of the arm. Okay, and nerve supply, now you studied pectoralis major, which is supplied by lateral pectoral nerve and medial pectoral nerve. Hope it is clear from where this lateral pectoral and medial pectoral nerve originates and how it is supplies to the pectoralis major muscle. Next, I'll show the pectoralis major muscle. 1 second. See, this is the pectoralis major muscle. I'll show the dissection also. How, after skin, superficial fascia, deep fascia. See, this is the pectoralis major muscle. Is it clear, students?
Yes, ma'am.
Roshni, can you tell me the pectoralis major origin insertion?
Ma'am, the pectoralis major has two origin by the clavicular head from the front of the medial third of the clavicle.
Anterior surface of the medial 1/3 of the clavicle.
Okay. And the second origin is the sternocostal head, which is from the anterior aspect of the sternum and upper 6 costal cartilages.
Upper first 6 costal cartilages. And what is the insertion? Where it is going to insert?
Ma'am, it's inserted into the lateral lip of the bicipital groove of the humerus.
What is the nerve supply?
By the lateral and medial pectoral nerve.
Very good. What is the root value of lateral pectoral nerve?
Ma'am, C5, C6 and C7.
Very good. What is the action of pectoralis major?
Ma'am, the pectoralis major is used for adduction and medial rotation. It's also used for the flexion of the arm.
Very good. Excellent. Thank you so much. And next about the pectoralis minor. So see the picture. No need to mug up anything. You have first in anatomy, you have to draw the picture in a fresh sheet with colorful paintings. Like you can use some, the good colors for muscles and nerves, arteries. There is a color code, but you can use any colors for just for studying in your book. But for examination, you can use any color. There is a code for the colors. Hope you are knowing about it and all. But your study book, it should be very colorful and very peculiar to each portion, origin, insertion. Okay, so from this picture itself you will get to know the origin. What is the origin, Magana Paul?
Yes, ma'am, I didn't hear you.
Okay, can you hear me? Yeah, what is the origin, Magana? First time is going. First what is the origin
Of pectoralis minor.
Yes, you are able to see my screen, right? I'm showing.
Yes, ma'am. Origin is from 3rd, 4th and 5th rib near the cartilage.
Yes, see, this is your first rib, second rib, 3rd, 4th, 5th. So this muscle takes origin from 3, 4, 5 cartilage, right? Ribs near their cartilage. And insertion?
To the medial aspect of thoracic process of scapula.
Yes, coracoid process of the scapula. And what is the action?
It is used for elevating the ribs during respiration.
Elevation of the ribs.
And
depression of the shoulder, correct. So that is the, okay. Then what is the nerve supply, pectoralis minor? Last dissection you may notice. Very good. Medial pectoral nerve. What is the root value? C8 and
T1.
C8 and T1. Very good. Okay. So who is next? Sandhya is there?
Yes, ma'am.
Yeah, subclavius muscle, right? So subclavius muscle from the first costal cartilage, it takes origin. What is the insertion?
In the subclavius groove, that is in the lower surface of clavicle.
Very good. What is the action of subclavius muscle?
It depresses the clavicle and this bone is during the movements of shoulder girdle.
Very good. You guys knows everything, I guess. No need to take the class actually. What is the nerve supply to the subclavius muscle?
Nerve to subclavius. Roots
From
are
where it comes? What is the root value?
C5 and C6.
Very good. Excellent. Very good. Thank you. Thank you, Santhya. And next is the last muscle, that is the serratus anterior muscle. So see the beautiful muscle, serratus anterior. So who will answer that? Sophia? Sophia, I will help you. Okay. The origin from the outer surface of 8 ribs and insertion to the costal aspects of see here, this is your scapula. So the costal aspects of medial border and inferior angle of scapula, and the action is it draws the scapula forward around thoracic wall protrusion and rotate the scapula. So that is the action of the serratus anterior, and nerve supply, that is the long thoracic nerve, that is C5, C6, C7, okay, from the posterior cord. So that's about the serratus anterior, okay. And we'll see about the clavipectoral fascia. So clavipectoral fascia, that is nothing, it's a strong sheet of connective tissue that is attached above to the clavicle. Below, it splits it to enclose two muscle, that is pectoralis minor muscle, and then it continues downward as a suspensory ligament of axilla and joins with the facial floor of the armpit. Actually, this muscle, this fascia between the pectoralis minor and the subclavius muscle, that also I'll show in the dissection video. Okay, so let me show that video 1 second. One second, students. You are able to see my screen, right? Hello.
Yes, ma'am.
Okay. Hello, students. You are able to see my screen?
Yes, ma'am.
Okay, okay. We are going to see the dissection of the pectoral region. So we have to know about the landmark. Okay, so this is your manubrial notch and this is your sternum. So sternum have 3 parts, that is the manubrium sternum, body and the xiphisternum. Okay, and this is your clavicle. Then another landmark, this is the nipple, this is areola, this is the nipple. Okay, then we'll start this incission. So if you are doing the incission from manubrial notch to the xiphisternum, so one horizontal incision. Before that, you can make incision from here, from the tip of the clavicle to the manubrial notch. That is one horizontal incision. Second incision, vertical incision. Then again one more horizontal incision, that is near to the posterior fold of the axilla. One more vertical incision from the nipple to the anterior axillary fold. Is it clear? We'll play the video.
Yes, ma'am.
Okay. Yeah, I will explain along with this. Yeah, so this is the sternum. 3 parts are the notch and xiphisternum, and this is body. So one incision from this notch to clavicle. See, this is another landmark. Okay. So this is the pectoral region. Now we are going to insect this pectoral region. So we are going to make the incision. Okay, first incision, this is the horizontal one. That is the notch, manubrial notch. Okay, second incision from notch to the xiphisternum. Third incision from xiphisternum to posterior axillary fold. Okay, and another incision, vertical incision. Okay, from till the anterior axillary fold. Now we are going to reflect the skin. This is very important landmark. Okay, so don't cut it. So after reflecting the skin, you will see the layers of the pectoral region. So skin, superficial fascia and deep fascia. Okay, so the skin means, yeah, skin. Then the superficial fascia, that also it is merged with the skin, actually it is already cut. So the superficial fascia, which contains the mammary gland, which is well developed in female and which is rudimentary in the case of male. And this is the deep fascia that is also already cut. So deep fascia, which is known as the pectoral fascia, which is attached with the clavicle and sternum. Is it clear? Students, is it clear?
Yes, ma'am.
Okay, fine. So after removing the deep fascia, what will be there? What is this? Pectoralis?
Major.
Pectoralis major, which is triangular muscle, and this muscle have upper border. This is the upper border and this is the lower border. Okay. After reflecting the pectoralis major, you will see the pectoralis minor. So see here, as you know, what is the origin of pectoralis major? Clavicular head, from the clavicle, and from the sternocostal head, that is from the costal cartilage, right? And this is the upper border of the pectoralis. See this one, upper border of the pectoralis major and lower border of the pectoralis major. The border of the pectoralis major, which is separated from the anterior border of the deltoid muscle. So in between where the forceps is going, so what is that area? Deltopectoral triangle. That is between the upper border. This is the upper border of the pectoralis major and this is the anterior border of the deltoid muscle. Between this, you are able to see a gap between the deltoid and pectoralis major, students?
Yes, ma'am.
Yeah, that is the deltopectoral triangle. Okay, and the pectoralis major having one clavicular origin and sternocostal head. So clavicle means here. So the clavicular head, it takes origin from the anterior surface of medial half of the clavicle, and the sternocostal origin means anterior surface of the sternum and third, fourth, fifth costal cartilage and from the aponeurosis of external oblique muscle. Okay, now he is showing the clavicular origin. This is the costal origin, sternocostal origin. Clear? And here you can see there is a lamina. I told you in the last slide when I was explaining the pectoralis major muscle, I told you this will insert into the, that's what, lateral lip of the bicipital groove of the humerus as a lamina. So here you can see this is the anterior lamina and this is posterior lamina. You just wait. He will cut the lamina now, anterior lamina. Okay. Yeah, this is anterior lamina. Understood?
Yes.
Now he is trying to reflect the anterior lamina. See, this is the posterior. Now touching the posterior lamina. So anterior lamina, posterior lamina. Okay. So that's why as a bilaminar tendon, it's going to the lateral lip of the bicipital groove of the humerus. And see, this is the anterior lamina of the pectoralis major muscle. The anterior lamina having three type of fibers. One is the superficial fibers, okay, superficial fibers which is going to the clavicle, and intermediate fibers which is going to the sternum, and the deep fibers. You are able to see? Hello?
Yes.
Yes, ma'am.
Okay. So three type of fibers in the anterior lamina: superficial, intermediate, and the posterior. Okay. And here you can see, after reflecting this, lateral pectoral nerve. Here, 1 second. Yeah, this is the lateral pectoral nerve. Is it clear?
Yes, ma'am.
Yeah, that is the medial pectoral nerve. Yeah, see this one, medial pectoral nerve. Lateral pectoral nerve and medial. How you will identify this medial pectoral nerve? Because after piercing the pectoralis minor, this is your pectoralis minor. After piercing the pectoralis minor, it supplies to the pectoralis major muscle. See, this is the pectoralis major, this is the pectoralis minor, this is the medial pectoral nerve. Is it clear?
Yes, ma'am.
Okay. Yeah, after removing the pectoralis major, now you are seeing the pectoralis minor. Pectoralis minor, it is also a triangular muscle which is supplied by medial pectoral nerve and lateral pectoral nerve. Okay, and it takes origin from the 3, 4, 5 ribs, not from the costal cartilage, and it insert into the coracoid process of the scapula. Okay. Yeah, here you can see the subclavius muscle. Did you see the subclavius muscle? So that is from the first costochondrial junction. It takes origin. Okay. So this is the subclavius muscle, and it is going to insert in the subclavian groove. Did you see the subclavius muscle? And which is supplied by the nerve to subclavius. That is the which one he is pointing. That is the subclavius muscle. Okay. And this area here you can see the clavipectoral fascia. Okay. The clavipectoral fascia, it is a strong connective fascia between the, it is above the clavicle, and below it is split between the pectoralis minor and the subclavius muscle. So here the clavipectoral fascia. And another important viva question, what are the structures which is piercing the clavipectoral fascia? Okay, what are the structures which is piercing the clavipectoral fascia? Yeah, the first structure, lateral pectoral nerve. Okay, he is showing the lateral pectoral nerve here. Then the medial pectoral. Thoracoacromial artery. Thoracoacromial artery, which is having 4 branches: clavicular branches, acromial branches, pectoral branches, and deltoid branches. So this is the thoracoacromial. Okay. After that, 1 second. Yeah. Sorry. Yeah. Now you will see the cephalic vein, which is going to drain into the axillary vein. Yeah. So which will drain into the axillary vein. So that is the third structure. And fourth structure is the lymphatics, which will drain into the apical group of the mammary gland. So hope you understood. Hope you understood all the structures which is piercing the clavipectoral fascia. I'll go back and I'll show you. 1 second. Yeah, this is the subclavius muscle. Here the clavipectoral fascia, that is above the clavicle. Below the clavicle, it is split into two between the pectoralis minor and the subclavius muscle. And the structures which is piercing are medial pectoral nerve, lateral pectoral. Here you can see the medial pectoral nerve and lateral pectoral nerve and coracoacromial artery and the cephalic vein. I'll show you. Wait. See. This is the subclavius, this is the pectoralis minor. In between is the clavipectoral fascia. Okay. This is the medial pectoral nerve. Students, is it clear?
Yes, ma'am.
Yeah. So that is the coracoacromial artery. This artery having 4 branches. Okay. What are the 4 branches, students? Clavicular, acromial. Tell me, Roshni.
Ma'am, deltoid, pectoral, clavicular, and acromial.
Very good, very good. And the third structure is cephalic vein. I'll show you. Wait, he is searching for the acromial artery only. Coracoacromial artery. Okay. After that, I'll show you. Yeah, that is the cephalic vein. Cephalic vein which going to drain into the axillary. Okay. Then after that is the last structure, that is the lymphatics, which will drain into the apical group of the mammary gland. So this is important, very important viva question. Okay. Very important viva question. What are the structures which is piercing the clavipectoral fascia? So this topic is clear. Any doubt from pectoral region? Hope you understood pectoralis major, pectoralis minor, subclavius and serratus anterior muscle. Any doubt, students? Hello? Can you hear me?
Yes, ma'am. Yes.
Any doubt in this topic?